Hey, folks, we're glad you're here. This is the Stay Off My Operating Table with Dr. Philip Ovadia. We have a guest today who I'm not sure we've ever had anybody on the show, Phil, with this particular combination of expertise, experience, and bodybuilding.
Yeah,
So I'm
very
looking
unique
forward to
background.
learning
That
about this guy.
makes me a
Uh,
little odd, but it's okay. I take it as a compliment.
our guest is Christopher Brandlin. Before we start talking with Christopher, though, Phil, why? What was it that compelled you to say, yeah, we ought to put this guy on the show?
If there are anyone else with his unique combination of talents. And what I'll say is, we've certainly had many carnivore doctors on the show. We've had carnivore nutritionists. We had a carnivore rabbi on, but Christopher is the first carnivore lawyer that we've had on the show. And
Okay, I'm going to
maybe
make
the
a
only
bad
one in
joke.
existence, certainly the only one that
You're right.
I'm
I'm
aware
going to
of.
make a bad joke.
Go
Aren't
for it.
all lawyers carnivores? Okay, we
Yeah,
can.
we do. We're sharks. We eat everybody. No, I hate
Yeah.
my own profession for numerous reasons. I have a lot of family who are attorneys and judges, and they hate the fact that I say most attorneys are going to burn in hell. I'm trying to get myself less time in purgatory. That's why I'm coming back to the hell.
Exactly. Real excited. I connected with Christopher recently, and we're going to talk about he's looking well beyond carnivore lawyer into carnivore politician. Some breaking news is he's now a doctor carnivore lawyer that we'll talk about as well. But before we get too far into it, let me give Christopher a chance to kind of introduce himself to our audience, give a little bit of his background, and then we can jump into all of the amazing stuff that he's been up to.
Sure. So I speak semi-fast, so I'll try to slow it down if possible. It's only to shorten probably about 15 to 20 years and maybe about less than 10 minutes. So anyways, before I became an attorney, I got licensed in 2011. I was a former fitness trainer and competitive athlete. I actually went into all natural bodybuilding during law school, but I, got my act cleared up, but I got into law school. And when I got into law school, I went from, a party alcoholic Van Wilder to someone not drinking for 2 to 3 years straight. And I got connected with a registered dietitian that focused on ketogenic diets, and it really inspired me. When I met with him, he put me on carb cycling. That got me really intrigued with this ketogenic diet. So you'd go ketogenic for 3 days and do a carb like refeed every third day. And I did it really intensely. I measured all my own food, and I basically doubled up the amount of training. And I went from 195 pounds to 155 to 160 pounds at very low. I think my lowest was like 4.2% body fat when they measured me. And I did that for about 1.5 to 2 years during law school because I didn't want to have any distractions. I even broke up with a couple of girlfriends because I didn't want to have any distractions. I just want to focus on school and training. I'm like, I'm going to do nothing, but I'm going to train my personal clients. I'm going to train myself in the early mornings at 4 a.m. every morning. And then I'm going to go to law school in the afternoons and evenings. And that's what I did. So I did that, and my last contest was Mr. Los Angeles Natural in 2010. I got published in Muscle and Fitness magazine, but I was like, I got it ready for the bar exam. So I took the bar exam, passed it, and then in 2011 I became an attorney, and I was practicing for the first 5 to 6 years. Even though I did have some different kind of events, started introducing a little more alcohol. Let's just say I'm not sure if it was stress or something else provoked it. I started getting really sick. I was like, I'm having problems. I went to a doctor. I'm like, I'm usually coming to a doctor for broken bones and stitches because I do a lot of stunts and I'm an adrenaline junkie. And I was like, yeah, I'm having some really gut discomfort, but it's not just my gut. It's like my joints, my muscles. I can't really wake up and work out in the morning. What's going on with me? And instead of becoming a routine patient, I became a routine customer. So when he said it'll be laparoscopic, you'll be in and out of the hospital with 1 or 2 days and you'll be fine. And let's just say it went completely wrong immediately right when the surgery was getting conducted because I'm not sure if they did not give me enough anesthesia. I woke up prematurely during the surgery while
Oh,
they're sewing up my intestines. Woke up in extreme pain, and and I was screaming. A very large hospital, UCI in Orange County, California. I was screaming, and just to put me to sleep, I think they gave me a combination of tramadol and morphine. And I took some photos, and I remember one of the physician's assistants, oh, it's probably just a hematoma. Don't worry about it. I'm like, you got to be kidding me. And then I sent it over to the surgeon. He's like, get to the ER ASAP. So 2 weeks later, after the surgery, which was early May, they said, okay, you know what? This is really bad infection. We're going to have to cut you back open. We'll give you a little bit of lidocaine, but I was completely awake. And even though they gave me some injections, I felt the whole effing thing. And I remember I did not want them to screw up the scalpel, so I just was trying to stay still. I even told Dr. Shafee a couple of years ago, I was actually biting my tongue to make sure I didn't scream, and I was actually bleeding from my mouth. So you can tell I built a good pain tolerance ever since then. And 2 to 3 weeks later, it got infected again. It started
Oh,
up.
ah,
So I was like, dude, it's not working. And then they had to send me again, same exact effing thing. Cut me back open, little lidocaine injections just to numb a little bit, but you're feeling the entire thing because that whole area, that anastomosis site was so effing painful and inflamed. And this time I managed it where it was getting slightly infected. It healed, but it was very restrictive. So I had to do physical therapy to kind of mobilize the scar tissue. But then occasionally it would start getting inflamed. I'm like, oh my God, I am so worried. And it happened throughout the rest of 2017. The next 6 months, I'm like, I was just like every other day, I'm like, I'm going to lose the rest of my intestines. This is horrible. And then I told him, I was like, you know what? It was towards the end of 2017. He's like, you know what? If you're still having problems, I think we got to remove the rest of your intestines. And this is where I just completely woke up. I'm like, all right, conventional medicine is going in the wrong direction. I just became a routine customer for pharmaceuticals and basically a guinea pig for a horrendous surgery that I will regret for the rest of my life. I'm much worse. I would have been better with just dealing with a little bit of discomfort or something like that. So when he told me that, I gave him the middle finger. I was like, I'm gonna do some extensive testing, blood work, because I think something's seriously wrong with me. I don't think you guys are treating the root cause. You guys are just treating some of the symptoms. So I actually did some extensive blood testing and urinalysis to test for like mold and everything. But it did show Lyme disease and co-infections, but I don't believe that was the true cause of my biggest issue. I think I just went down the wrong rabbit hole. Okay. So what I ended up doing going into 2018, I did an extended water fast, 10 days, because I was already a little underweight. But I was like, I got to make sure this thing seals. And I was like, I don't want to eat anything. This is going to be a prayer for God if I could last the 10 days. But this is the only time, because I've done shorter fast, 2 to 3 days. And I actually did fasting, like a fasting clinic. It was like 4 to 5 days one time, but it was all vegan clinic. So whenever they refed me on just vegetables and fruits, and sometimes they do fruit and vegetable juices, which completely cause bloating. I'm like, you just ruined a good fast. I was like, you know what? I looked into the GAPS diet, gut and psychology syndrome diet by Dr. Campbell McBride, Natasha Campbell McBride, I believe her name is. But it was always focused on bone broth and the meat, and basically meat stew. If you're having histamine issues, instead of doing the bone broth, you do a meat stew as an introduction diet, and then it's kind of like elimination. You just slowly introduce. But the main source of healing was the meat. I was like, I think there's something to this. So right after the 10-day water fast, I did a slow roasted steak as my first meal. And it was the most amazing feeling ever, that my gut feel amazing better. It was so soothing. And I was like, you know what? Something's onto this. And I started just doing elimination after this going into 2018. And I told some of my friends, because most of my close friends are not attorneys, by the way, Jack. I hate most attorneys. I already told you. Most of them are going to burn in hell. But anyways, most of my friends are in the health and fitness industry because my passion was health and fitness as a fitness trainer and competitor. And I did sprint triathlon. So a lot of my friends are in the health and fitness industry. I was like, you know what? I got to tell you guys, like my best friend, Brian, I can only eat meat. I can't eat anything else. He's like, you know what? There's actually it's actually a diet. People just eat meat. I think it's called like the carnivore diet or something. I have the Paleo Medicina clinic in Budapest, Hungary. I've been following these groups, and a lot of them go over there to heal. And they're one of the few meat-based groups that actually have clinical trials showing that a meat-based diet can put so many conditions and diseases in remission. Even putting like a stage 3 or stage 4 colon cancer remission. They had the clinical trials from 2010. I'm like, they look like they're spending the most time on it. So I decided, I Skyped with them. I flew over there Thanksgiving Day, 2018 in November. And I met with Dr. Sophia Clemens, and she was married to Dr. Saba Toth at the time. She made it very clear, you're not allowed to take any vitamins, no supplements. I was like, really? Are you sure? She's like, you're only allowed to eat meat, fat from the meat, salt, and water, nothing else. But you know what? I stayed with them for almost 10 days. I felt amazing. But anyways, when I came back to the United States, I was so impressed because I never got the one-on-one treatment with Dr. Sophia Clemens, and that's why I do consider her my hero still to this day, and I still speak with her. I'm going to try to visit her during my campaign. I was like, you know what? She was following up with me as I came to the United States to make sure I was continuing the program of the PKD diet. By the way, the paleo ketogenic diet is something they trademarked over in Hungary, and I started working on a trademark here in the United States as a sign of pro bono to thank them. And they're 80% fat because ketogenic is 70% fat. They're 80% fat because they do know and believe that fat from an animal-based source is a true healing mechanism. And not just that, she gave me a reference to all the reputable farmers for the best meats in the United States. You would never expect that. You're getting like the best like consultational advice and follow up in one-on-one after you got it from a doctor with a PhD over in Budapest, Hungary. I'm like, none of my American doctors treated me like this. I was like, this is amazing. But anyways, I actually spoke out against the vaccines, and I actually made some comments to the LA Superior Court because they're trying to force us to get, all the mask and get vaccinated to go into the court. I just talked about how there is no efficacy. It's completely ridiculous. And you can never impose government mandated healthcare. It's completely against our constitutional rights. And the judge, the son of a bitch, what was his name? Bogdanov, he tried to sanction me. And then my peers didn't like me and thought me a risk to public health, try to report me to the effing California State Bar and the Texas State Bar because I just got licensed in Texas 2 years before that. So I was like, I'm going to get my PhD, and I just got my dissertation approved and finalized. So I just became Dr. Brandlin, 2 to 3 weeks ago. So I updated that, but I made my announcement to run for the House of Representatives in the 3rd District of Nevada in January on Fox News. So, I'm not expecting everybody to be completely carnivore and eat nothing but meat. I'm like, we need to eat real foods, and we need to basically restrict the ability for these pharmaceutical companies to manipulate not only the politicians, because 2/3 of Congress are paid from pharmaceutical companies. I'm not sure if you know that, Jack. I also call out the fact that all the medical institutions, as I confirmed this with Kiltz, Berry, Baker, and Shapey, that the majority of the curriculum in most medical institutions are pharmacology, and they spend less than 20 hours total on nutrition, sometimes even less. I think Barry told me a couple months ago that he's like, dude, we didn't even spend like a dozen hours. It was like it was like a 1 semester thing, and we did like one meeting a week for 12 weeks or something like that. And that I was like, you know what? If you go to a doctor and your doctor immediately reaches for the prescription pad and he tries to prescribe you medication without asking about your diet or your lifestyle, you don't really have a doctor, you have a drug dealer. And that's the whole analysis. And that's why I'm here today.
So,
I try to condense like 15, 20 years and like.
That was fantastic. That may be
All
more
right.
words in less time than we've ever had.
Exactly. Just to sum up, we have doctor, lawyer, politician, bodybuilder, nutritionist.
And this is why I do believe that health is a very major and important bipartisan topic that's going to require both parties to come together, collaborate, and reach a best kind of compromise for the public health. And remember, you shouldn't be benefiting yourself. You shouldn't be benefiting whoever's paying you in the back pocket. You have taken an oath to be a public servant to the country. And the carnivore diet and the carnivore community saved my life. And that's why I owe it to the health community. And that's why I still kind of praise Dr. Sophia Clemens to this day. I mean, but my real family that's kind of healing me is the carnivore community. This is why I feel like I owe something back to the community. And as I already told you, Jack, I think most attorneys are going to burn in hell. I represent some people I am definitely not proud of in the past. I need to spend less time in purgatory. This is why I want to make a change for the public health. And this is why I worked my ass off and get my MBA, and I did my investments for the past 5 to 7 years in different states. I want to make sure I don't have to suck up to any kind of corrupt politician or suck up to any big corporation, because once they give you a larger check, they will say, hey, remember I helped you out? I need a little favor. And that favor they're going to ask is going to be something that's going to be turning to making a policy or making a recommendation at a congressional hearing. And so what you're going to do is, instead of serving the American public, you're actually going to be serving them, and they're going to be the only ones benefiting. And maybe your back pocket if you're collecting that. Even with my own experience, I don't have a bias against doctors. I think there's a lot of doctors who I'm not going to call them uneducated or uninformed. I'm going to call them miseducated and misinformed. Health is a huge issue right now. We're seeing childhood obesity just got to 20%. It's the highest it's ever been. And that's obesity. 1 out of every 5 kids is obese, not just fat and overweight, obese. That's a huge issue. Let's restrict these pharmaceutical companies from having so much control. Not only over Congress, but probably the most important thing is over Congress, because that's going to be the ones making the changes and people pushing vaccines, but also over our future doctors. Because I think one of the biggest concerns is not over our overall health as adults like you. My biggest concern is our future generations, the younger kids. They're our future leaders. We got to make sure they're going to be in better positions than us right now. Yeah. I'm a very religious person. I think karma is going to come back to me if I have to bring the wrong choice. I'd rather help out people. I'd rather have a good afterlife. So, last statement.